Welcome everyone. Today we want to speak about neck pain or trapezius muscle pain. Normally this is the pain a person gets up in the morning feeling the pain. Maybe in the last night you slept very well, it was okay, no problem. You wake up in the morning and you feel pain in one side of the neck, sometimes also that same side of the shoulder and the upper back. So this can be termed as the trapezius muscle pain. So what do we do in the management? There are a few steps we use in the management. One is a gentle massage. This works. It actually really works because this muscle, mostly what causes pain of this muscle is spasms, or the muscle becomes a bit stiffens and has spasms, small vibrations. So when you do a gentle massage with oil or powder or freehand massage, it can help to relax that muscle, that spastic muscle, which can in turn reduce on the pain which is felt by the person. So this is number one, a gentle massage is used and it is very helpful. Number two, we can use thermotherapy or temperature therapy. We can either use low temperatures or we can use higher temperatures. Having the body temperature in the minimum or in the medium, you can either use temperatures which are below the body temperature or temperature which is higher than the slightly higher than the body temperature. Both of them they produce the same response. So you can either put ice, you can get some ice, wrap it in a towel or wrap it in a cloth. Don't put directly, wrap it in a cloth, then put on the place of pain for 5 minutes. Or you can get warm water, a warm water bottle, put some warm water, still wrap in a cloth or towel, and then put on the area of the pain for between 10 to 15 minutes. This can be very helpful because of the temperature difference between the body temperature and whatever you are putting, either hot or cold, it will initiate an immune response or a defense mechanism which can actually reduce on the perception of pain because it takes away what is causing the pain. The body now is aware and it tries to clear away what is causing the pain. So those are two things we do to manage this trapezius pain. One is a gentle massage. Two is applying heat or applying cold. Number three, what we do, physiotherapist or professional physiotherapist usually, we have a machine we call the TENS, transcutaneous electrical nerve stimulation. This is a machine which stimulates the muscle using the skin. So it has electrodes you put on a muscle which has pain, in this case the trapezius muscle, and then activate the machine which will cause a few vibrations and it can relieve the pain temporarily. So those are three. We use massage, we use heat, we use a machine, an electrical machine to cause some vibration which relieve the tension and therefore relieve the pain. Number four, we use what we call isometric exercises. These are very nice exercises. These are exercises which are done without the movement. They don't allow the movement, but there is contraction of the muscle. This is very nice in treating the trapezius muscle pain. So those are four. And then from the isometric exercises, a person can upgrade to isometric. Yeah, from we can use isometric exercises. These are exercises you do without any movement, but there is contraction of the muscle. Then from them, you can actually upgrade to isotonic exercises, which are movement, which are exercises, muscle contraction causing a movement in the neck. And then you can also upgrade to resistive exercises. So these are how we progress. These are all managements of trapezius muscle pain. Normally, there is a posture intervention, because most of the people with the trapezius muscle pain, they adopt a stooped posture or a forward bending posture. So if we add some posture exercises or posture awareness, it can really be of help. That is very important to add. And also in the management, it is very important to speak about activity or general body physical activity. Normally in athletics, this is rarely a problem. The problem is mostly in sedentary people. So a change in lifestyle, yes, adding some bit of exercise in the day-to-day activity or in the daily life is very important. You can add a bit of activity, for example, walking or stationary bike or treadmill for around an hour, 45 minutes to 1 hour for at least 3 days a week. This can be very nice in terms of lifestyle change, which can actually be a treatment for trapezius muscle pain. So those are the treatments we use in the management of trapezius muscle pain. A recap: number one, we talked about a gentle massage to relax the muscle, which can cause relief. Number two, we used heat or cold. We can either use heat or cold to put in the area for some time, then it can cause some relief. Number three, we talked about isometric exercises. These are exercises which involve contraction of the muscle, but we don't allow movement. Then we can upgrade from isometric to number four, which is the isotonic exercises, exercises with movement. And then from isotonic exercises, we actually move to resistive exercise. We resist the movement and we strengthen the trapezius muscle. And then from that, we also educate about the posture. It is very important the person adopts an upright posture and forgets about the bending posture or the stooped posture. We maintain an upright posture. And then we also educate about the physical activity, trying to change the lifestyle from being sedentary to actually being a more physically active person. So this is how we manage the trapezius muscle pain. In the next video, we shall talk about each of the treatment interventions specifically, explaining them in detail. But these are the 7 ways we can manage trapezius muscle pain in terms of physical therapy. No medicine involved, no injections, no nothing. This is it, the magic, and this is how it works in these ways.